So I'm going to go through a little bit of what pelvic floor physical therapy is. We are in my clinic for pelvic floor physical therapy. Typically, I run through a whole nother piece of the puzzle with the patients, but if we happen to do an internal portion of the pelvic floor muscle assessment, this is typically what it looks like. We have a plinth or a mat that patients lay on, so I'm going to go ahead and go through that. I'm going to lean back. I'm going to pull this up a little bit. So ladies or men will typically undress from the waist down. So I'm not going to do that on camera. They'll undress from the waist down. They'll cover up. They can keep their shirt and top on because I don't need to see anything up here. What I will typically do is assess if they have any scars in the abdomen. So for instance, I have C-section scars, so I may lift up the shirt of the patient, roll this down with a towel, check mobility of scar tissue. Excuse me. If there are any other scars for maybe an appendectomy or a gallbladder surgery or cyst removal, we will definitely assess the mobility and tissue mobility of those scars because that can really hinder or play into other symptoms that are going on. If patients are dealing with constipation or any kind of bowel issues, I definitely want to do an abdominal massage or acupressure points to help improve motility. Definitely teaching patient where there might be tension being held in their abdomen and what we can do to improve the mobility there. So giving them tips and tricks at home for their home exercise program. And definitely going through different techniques while in the clinic. So when they leave, they're hopefully feeling improved and feeling more mobile, less clogged up if they are dealing with constipation. I love hearing that a patient's going to have or has had a bowel movement within the 24 hours of them being in here, just because we're creating, helping to improve that peristalsis of the bowels in the abdomen. And after that, after we I assess everything here, mobility of ribs, tension in the tissue in the abdomen, I like to then follow that up with the internal pelvic floor muscle exam. So, excuse me, this is the internal portion of the pelvic floor assessment that we do. So I have my patients lay here. Usually legs are supported by pillows or a foam roller. And then I like the patients to feel comfortable as we assess the tissue. I have one gloved finger that we're assessing the tissue with. So when we're doing the exam, excuse me, when I'm doing the exam, I like to feel and walk the patients through exactly what I'm finding with the muscles. So this could be letting them know, hey, this is what the first layer on the right side feels like. This is what the left side feels like. I want them to tell me, are you having any pain or discomfort? How does that tissue feel for them? Really helping them understand what's happening inside the pelvis with those muscles. Because just like anything in the body, you can see what's happening when you move a joint, but you can't see the inside. So I want to really help paint a picture for the patients to let them know. And I'm not doing an internal exam without getting consult, whether it's written consult and then asking them in person, but we want to make sure, or consent, that we're getting the consent before doing the internal exam. Very small portion to anything and everything with pelvic floor physical therapy, but if we're dealing with any kind of pelvic pain, hypertone, hypertrophy of tissue, we want to, assess that tissue if we can. If we can't, there are tons of stuff that we can do externally as well. So just to give you a little picture of what's actually going on in a physical therapy session.